Good afternoon. I'm Lawrence Havenga. I manage the Multimin company out of Fort Collins, Colorado. And today we're going to discuss the usage of Multimin 90 product in beef cattle. And I think it's always good to just take a step back and look at what data currently exists on why, after 60 years of feeding trace minerals to cattle, we took the decision to develop an injectable trace mineral for cattle. So just to relook and revisit some of the historic data, if we look at just some of the trace minerals and how they occur in the forages that we feed cattle, it already starts giving us a clear picture of why we're not managing it 100% even today. And one of the key reasons is that within the forages that we feed cattle, there exist two different types of trace minerals. We have the types of trace minerals that really contribute to health and reproduction, and then unfortunately there also exists a group of trace minerals which antagonize or tie up some of the trace minerals that we really need in these animals. So the example we have here is just a map of the US showing where molybdenum, which ties up a lot of copper, naturally occurs in forages. And you can basically see that if we take the US and we cut it in half, the western side has significant issues with molybdenum, so we have a huge part of Texas. If we go north, Oklahoma, Kansas, right up to the Dakotas and then west. And the problem is that in these areas, even if you have enough copper in your oral supplement, you're going to have something that'll be brought in by molybdenum in the pasture that's going to tie that up and actually reduce what the animal takes up and utilizes. And unfortunately, if we look at the good minerals that we require, they actually do not occur in overabundance in the US. If we look at copper concentrations in plants in the US, you can see that if we look at areas where we don't have enough copper, we basically have exactly the same area where we have the antagonism with molybdenum on the western side. So we have a problem on the western side where okay, there's not enough copper in it, but the little bit that's in there is also exposed to molybdenum. If we go to the eastern side, we actually have this area in, there's a small part of Oklahoma, Kansas, Missouri that has enough copper in these plants, but you can see the majority of the US here doesn't have enough. What is of major concern is these white places like Florida, the central part of Texas, Oklahoma, Kansas running north, this big part of Montana up here. This is where we have less than half of what an animal is going to need in the diet in our plants. So here we have a big problem because there's just not enough in these plants. If we look at selenium, we kind of see the same deal. The West Coast and the East Coast are really, really deficient from a forage point of view with regards to selenium. So that really explains why after 60 years of feeding trace minerals, we still have difficulty because the bulk of feed that we feed comes from a plant source, and unfortunately these plant sources do not contribute significantly. Now, just to review how these things function within the beef cattle, let's just quickly review 2 or 3 of the key trace minerals and their key functions with regards to reproduction. So if we look at copper in the cow, in the beef cow, copper plays a role in estrus expression, so we see a delay of estrus in the cow. Copper is also part of a very, very potent antioxidant system, the superoxide dismutase system, which protects embryos. And we see a significant increase in embryonic death when we don't have enough copper in those beef cows. The others are of importance, but I'm not going to discuss them. If we look at zinc, one of the key problems we have in the beef industry with the zinc deficiency or imbalance is we see an increase in assisted births. We see that these calves are carried a little too long, they become a little too big, and these heifers or cows have a problem in giving an unassisted birth. When we look at manganese, manganese is a precursor of all the steroid hormones that we see in the reproductive system of both the cow and the bull. So when we need testosterone, we need estrogen, and we need progesterone. If we do not have enough manganese, cholesterol is not going to be converted to those hormones, and we see total shutdown of the estrus cycle. We see an increase in abortion because there is not enough progesterone. If we review the bull a little closer with regards to copper, we have 2 deals there. First one is libido. The will to mate a cow is suppressed The second deal is the formation of sperm is suppressed, so we do get a smaller quantity of sperm being produced with a copper deficiency. If we look at zinc, one of the key deals with zinc is we see it, if we don't have enough zinc in the bull diet, especially when developing those bulls, we see a decrease in testicular size, so that bull will never reach his full genetic potential because he's going to have small testes and he will just not be a major contributor in the herd. Manganese actually complements copper, where copper actually plays a role in the quantity of sperm that we produce. Manganese actually plays a key role in the quality of those sperm. So we see an increase in abnormal sperm if we don't have enough manganese in those diets. Just to review of how our whole approach to trace mineral nutrition has changed in the last 30 to 40 years. 40 years ago, most veterinarians and nutritionists were spending their time finding out when we see clinical signs of a deficiency, like calves going down with white muscle disease, how do we prevent that white muscle disease and how do we treat that white muscle disease? However, more and more research has shown that by the time we reach clinical signs, the problem is that we have depressed the immune system to the point where vaccines are not effective. And we've also depressed these animals' reproductive systems to the point where they're not reaching their genetic potential in breeding. So if we look at the big paradigm shift in the last 40 years has moved from the treatment and prevention of clinical signs, it has actually moved over to the prevention of subclinical problems. So a lot of research and a lot of effort is going into how do we get a good immune response and how do we improve fertility in these animals long before we start seeing these clinical signs. So let's just review on why we did this research to develop an injectable product. And there are a couple of key reasons. The first one is we supplement each animal that we inject. John Arthington has done a really good bunch of research out of the University of Florida where they looked at the intake of the animals when we provide a free choice supplement, and typically the data shows that somewhere between 60 and 80% of animals are going to eat what we actually recommend them to eat 60 to 80% of the time. So there's going to be a group of animals that are going to eat either too much and a group of animals that are going to eat too little. And then we also have the time factor that yes, 60 to 80% of the time they're going to eat enough, but there's going to be somewhere between 20 and 40% of the time when these animals are not going to eat enough. So the big variation that we see across a herd when we put out a free choice is a reality that we can actually manage when we use the injectable, because we can make sure that each animal that we stick that needle into receives its supplement. A second key reason for us is we bypass any antagonist. We discussed the molybdenum on the western part of the US tying up copper. Another big issue that we deal with is sulfur, and the origin of sulfur is actually something which we artificially deal with in the US, and it's something which we actually make worse every year, because if we look at the biggest origin of sulfur in the cattle diet, it actually comes out of the supplements we feed these beef animals. So the first supplement that we immediately think of when we talk about sulfur is going to be molasses. Molasses do contain a bunch of sulfur, so we just need to make sure that we take care of selenium, zinc, and copper when we feed a molasses supplement. But one of the biggest areas where we're seeing problems with sulfur is with distiller's byproduct. If we look at distiller grains that we put into breeding herds, especially over a long term, trying to get those animals to bridge a winter period or a fall winter period, we need to bear in mind that the amount of sulfur in those distiller byproducts is going to impact the copper, selenium, and zinc status of those animals, and we need to find a way to actually deal with that. Now, by using an injectable, we do not have anything that goes through the gut that's going to be in contact with these antagonists. We actually put it into the animal's bloodstream, so we totally bypass these antagonists, and it's a handy way to deal with areas where we have major antagonistic problems. The one area where we also see a lot of sulfur issues originating from, especially from Montana, Wyoming, the Dakotas, and Colorado, is actually the sulfur content in drinking water. We need to understand that an animal on a day-to-day basis is going to drink a lot of water, and if we have high sulfur in water, it is number one, it's going to be very high quantities of sulfur getting into that animal, and number two, it's a constant thing. It's going to be on a daily basis. So just always keep the water in mind. A third component which we have shown with a couple of different studies is we really supplement fast when we put the injectable in there. If we look at making an oral trace mineral available to these animals, it is an efficient way of getting the mineral in there, but it takes time because they consume small quantities every day, and we have this gradual improvement in mineral status in those animals. And very often we don't have the luxury of time to wait for them to elevate their mineral status. We need it to happen a little quicker. And this is where the injectable offers a really big benefit, because when we supplement with the injectable, we get that trace mineral into those animals the same day. And I will show you some data later on how we actually improve levels within those animals. And I think something which is really key for me from both the veterinarian and the producer standpoint is we can actually time the injectable to spend the money when the animals really need it, because it's a big fallacy that animals need the same level of mineral every day. Yes, they do need mineral every day, because on a daily basis they're going to make use of it and they're going to lose a little bit through the urine. But I think what is very key to understand is there are very key physiological times when they need a lot more, and this is a handy way of spending the money when they need a lot more and we can get it into them. So just to review a little bit the antagonism issues that we deal with, there are two different ways that these antagonists actually tie up these good trace minerals. If we look at sulfur and iron, they both play a role in tying up copper, and basically what happens is in the big old rumen where all the fermentation takes place of all the forages, the sulfur and iron will form a very stable complex with copper which cannot be broken, and this complex will basically be taken out the backside of the animal, and the animal will pass that copper in complex with sulfur and iron. Now what we try and do to relieve some of this tie-up is to feed more expensive organic trace minerals, and it does relieve this from a certain extent, but unfortunately it comes at a significant premium from a cost point of view. If we look at molybdenum and sulfur acting in tandem, it's a little bit different, because not only do the sulfur and molybdenum tie up copper and pull it out the backside just like the iron and sulfur will do, some of the sulfur and molybdenum combinations, which is called thiomolybdate, actually gets absorbed into the bloodstream of the animal, and it'll actually tie up some of the copper in the bloodstream. So you may take a blood sample and the copper may look pretty good. However, that copper is not available for the animal to work with. And again, the injectable offers a good benefit there, because not only do we bypass the system, but if we inject it and we make a bunch of copper available, we can get rid of these little tie-ups and actually elevate the copper in the bloodstream where it is needed. So I just want to do a little bit of a brief review on how these trace minerals flow through the body and how they work in the animal. Now, whether we inject the trace mineral or whether we feed it orally, it has to be transported through the body. And our source of transport in the body is the bloodstream, and we really are concerned about the trace mineral that's available in the fluid part of blood, in the serum. And basically this is going to act as just like the fuel line within a vehicle. The trace minerals within this blood is going to be transported to all the different tissues within that animal, and they can make use of it as it is required. Now in bovine we have a very unique system in that the liver actually plays a couple of different roles when we discuss trace minerals. The liver actually has three very distinct roles when we talk about trace minerals. Number one, it acts as a storage source. So if we have a lot of trace mineral in this bloodstream and the animal's not going to use it all, as the blood circulates through the liver will actually act as a sponge and start absorbing it, and it'll keep it for a later period of time. So I always tell people the liver for me is the gas tank in a cow when we talk about trace minerals. There's a bunch of trace mineral that's going to be stored in this liver. Now, the liver also has a very unique capability of actually re-releasing some of that trace mineral back into the bloodstream. So very often in times when these animals require more trace mineral, the liver will actually elevate your blood system by releasing trace minerals back into that blood stress system. Now, if we overdo it a little bit and we put too much trace mineral in there, the animal must have a little bit of a release valve to get rid of some of this trace mineral. And the liver also plays a key role there because we have the bile system. And basically what will happen is the trace mineral that's too much to be stored here will be excreted. The animal is going to put it into the bile system and the gallbladder, and eventually it will go into the small intestine and leave the animal. Now, there is a threshold where if you overdo this too much, you may harm the liver. So just bear in mind that these trace minerals all need to be handled with respect and you know, just within label recommendations. The one organ which is hardly ever discussed when we talk about trace minerals are the kidneys. And unfortunately, the kidneys will filter blood on a daily basis, so we will have a net loss of trace minerals out of the kidneys because every time the animals are going to urinate, there's going to be a little bit of copper, a little bit of zinc, a little bit of selenium, a little bit of manganese in there. And that also accounts for the need to have a supplementation on a daily basis. Every day these animals need to get some trace minerals in orally because they're going to lose some through the kidney, and obviously they're going to use some in the body. So where do these things play a role? And I think that is the key thing is, you know, okay, so we have a fuel tank where these things are stored, we have a fuel line where they're being carried through, and now we need to find out where the spark plugs are. And the spark plugs in the bovine really are these different enzyme systems. And what these enzyme systems do is they require trace mineral as a component to them. And being a component of the enzyme, if the trace mineral is not there, we're going to have low enzyme levels. But these enzymes are really the key things that drive immunity and reproduction. It's not copper by itself. It's not selenium by itself. It's once selenium is incorporated into glutathione peroxidase enzyme that we see less retained afterbirth, because the enzyme actually helps the cow to get rid of that afterbirth. It is once we have good copper and zinc levels built into superoxide dismutase that we see a good solid immune response when we put a vaccine into those animals. So yes, the trace minerals are really critical, but they're critical as part of something else. They're part of these enzyme systems. However, there is a certain portion of these trace minerals that actually form part and parcel of structural parts of the body. So if we look at zinc for argument's sake, if we take zinc and we drop the level low enough, we're going to start seeing cracked hoofs because zinc is part of keratin, which is part of skin and hoof. So we're going to see flaky skin, we're going to see the cracked hoofs, and the same with selenium. If we drop selenium low enough, selenium is a key structural component of muscle. So if we drop selenium low enough, we're going to see white muscle disease because that muscle just doesn't have enough selenium, which is a structural part of it. So that's just kind of to put it into perspective, because when we look at the data that we present on how the injectable works, we need to actually show three things. We need to show that if we supplement, we actually do get more into the fuel line. We also need to show that, well, some of it, that the ones that's not going to be used in the fuel line actually get stored, but then we also need to show that we actually help these enzyme systems or the spark plugs to fire a little better. Just before we start looking at some data, I'd like to review the label a little bit, because it is very important, being in the food animal producing business, that we adhere to label recommendations. Just a couple of points I want to make. If we look at the content of the trace minerals, we have 60 milligrams of zinc per cc, we have 10 milligrams of manganese, 5 milligrams of selenium, and 15 milligrams of copper per cc that we inject into animals. You will see that the product is labeled for use both subcutaneous or under the skin and or intramuscular. Now, with what we promote very strongly is to adhere to BQA principles, and we would like in the beef industry for people to make use of the subcutaneous route. Now, there's one or two practical points I would like to share with you. When we do a sub-Q injection, we need to tent the skin. We need to grab the skin, pull it away from the animal, put the needle into that cavity that we have produced, and inject the product. And especially with something that contributes 90 milligrams, which is very concentrated trace mineral per cc, if we work rough and we start scratching underlying tissue with a needle, and we cause a little bit of bleeding and we inject that on there, we're going to find two things. It's going to sting a little bit because we haven't done our job properly, and it may result in a little bit of swelling because it may draw a little bit of excess fluid. Those swellings will usually go away within a day or two, so we actually have that mentioned on the label. If we look at the dosage recommendations on this product, you will see that we have an increased dose for younger animals because they do grow very fast and they make use of these trace minerals a lot more when they're younger. So up to calves up to a year of age, we do 1 cc per 100 pounds. Between 1 and 2 years of age, they're still growing, but they're growing at a much reduced rate. So we do 1 cc per 150 pounds, and then mature animals do not grow. But what we're doing is we're just strategically topping them off, and there we do a 1 cc per 200 pounds. The product is chelated as an injectable, and because it contains copper and selenium, federal law restricts this drug to be used by or on the order of a licensed veterinarian, so it is a prescription remedy product. So let's look at a little bit of data on this product and how does it work. We have really good partners at Iowa State which did some of this research for us. And basically what we wanted to find out is once we inject this product and we put it under the skin, how quickly do we actually see a change in blood level? And the common deal here is, regardless of whether it's zinc, manganese, selenium, or copper, 8 to 10 hours after you have injected this product, you're going to have your peak in the bloodstream. Now, the interesting thing is that for about a day, for about 24 hours, the animal is going to tolerate that at very high levels within the bloodstream. So it's going to expose all the tissues of the animal to this very high level of trace mineral. But after 24 hours, the animal is going to start doing something with that trace mineral, because if we leave it in the blood indefinitely, what's going to happen? The animal is going to filter it all through the kidneys and it's going to be lost. It's going to be urinated out. So we needed to look at the second phase, is how do we actually impact the storage organ? How much do we put in the tank? So you'll see that immediately following injection, at 24 hours after injection, we start putting more zinc in there. We put more manganese in there. The two that are really well stored in the liver is we really make a huge impact with regards to selenium and copper. We put a lot of zinc, a lot of copper, and a lot of selenium into that liver. Now, very often people will ask, okay, so this data, this specific study stopped at 15 days. How long does this last? How long do we push this out? And if we look at some more recent work we done at Iowa State, which has not been published yet, we look at about a 60 to a 90-day window of supplementation with a single injection with this product. However, we also need to see how do we actually impact these enzymes. And you can see that basically immediately following injection of the product, you will see elevation of the enzyme. But it takes about 2 weeks for them to really show a nice statistically significant increase. Now, this increase will continue, and there's data out there now that shows that it'll peak at about 30 days. And that is key for us when we look at how we use this in breeding programs. Because what we want to try and do is we want to coincide breeding and conception with when these enzymes are at their peak. So it takes about 30 days for them to peak, so we typically would like to put the product in there 30 days before we breed those animals. Now, I very often get the question, if that doesn't fit my system, do I go closer or do I go further away from that 30 days? If we look at these enzymes, they're all protein-based enzymes, so they have a fairly long shelf life. So they all last between 60 and about 120 days. So if I get that question, I would rather back it up a little further away. So instead of doing it 30 days before breeding, you could do it 45 days or 50 days before breeding. However, I would not go closer than 2 weeks, because we can see that at 14 days we have statistically significant differences. If we do it earlier, it's not going to, you'll lose some of your benefit. Now, just to review how these trace minerals flow from cow to calf and how that changes things and how that makes us think about how we structure a supplementation program, we just need to review how these things work. So if we look at the cow, and this is the afterbirth, basically this afterbirth is connected to the cow with these cotyledon caruncle conjunctions. And basically all these trace minerals are water soluble. So what the cow is going to do is she's going to push that mineral through this cotyledon caruncle conjunction. It's going to end up in the umbilical vein and it's going to run into that baby calf. And basically the first organ that this umbilical vein runs into is the liver. So what's going to happen is in the last 75 to 80 days, the last 2.5 months of gestation, this cow is going to start stacking this calf's liver with trace mineral. Now, why would she do that? The first reason is that this calf is going to grow really well and really fast once it's born. it will immediately need trace mineral to help it fend off a lot of the challenges it's going to get from pathogens out there. So a lot of baby calves get sick, and they need a lot of trace minerals at birth to help their immune system. Now, the second and key, most important reason for stacking this liver is cow's milk is an exceptionally poor source of trace mineral. If we look at the content of zinc, copper, selenium, and manganese in cow's milk, it provides less than 0.1% of the daily requirement of trace mineral in that calf. So unfortunately, that calf will not get trace mineral from the cow through the milk. So she needs to find a mechanism to make sure that this calf has enough trace mineral in there to run after birth. Another key point, and I've alluded to this when we started, is that mineral status or needs vary in these animals. They do not stay the same. They're not the same on a day-to-day basis. This was a study done by Connie Swenson, and basically what she did is she took a beef cow or a bunch of beef cows, and she did serial biopsies starting pre-calving, so shortly after calving, before we put the bulls in, when they weaned the calves, and pre-calving the next season. And she tracked two things. She tracked what the liver levels looked like, and she also tracked what the blood levels looked like. And this is typically what we see. In that pre-calving window, before these cows calve, they are mobilizing trace mineral from the liver. So what happens is the liver levels go down. So where does that mineral go? They put it into the blood. They shove it into the blood. So blood levels go up. And the reason why those cows do it is they're creating a positive gradient to drive mineral into that baby calf. So she's really driving that trace mineral into that calf. Now, unfortunately, at calving, we have a very bad thing happen. Because as soon as the umbilicus breaks and that calf drops out of that cow, the total mineral component that you put into this calf is no longer available to her system. So basically what we end up with is now we have a bit of a mismatch, because now we have the liver has now reached rock bottom on how much it was going to give, and the blood level is going to start to come down because she doesn't need that positive gradient again. Now, the real critical deal is it presents us with a little bit of an issue at breeding. Unfortunately, the way that we have decided to manage beef cattle is that we would like to breed them back as soon as possible after calving. And you can see this is the worst time to do it, because we have low liver level, and unfortunately we also have low blood level. So there's just not enough mineral in that cow. If we leave her to her own devices and just leave her to eat and all that, she's going to repair herself, but it's going to happen at weaning. We just cannot wait that long. So the key principles when we look at using the injectable is we would like to do something here pre-calving and possibly contribute positively to this animal status, but more critically, we'd like to do something here pre-breeding to see if we can help this animal out of this deep trough. So this is really what happens in that cow. And to put it into perspective, you need to realize that all of the trace mineral in this package comes from this animal. And once that umbilicus breaks, it's gone. She's not going to get it back unless we feed it or unless we inject it. And very shortly after doing this chunk of meat in the afterbirth contains a bunch of selenium and a bunch of copper. And this is going to be lost as well. So we need to just figure out how we're going to replace the trace mineral in these two components that this cow has passed. And this is what serial biopsies have told us with all the other minerals. The problem that we run into at calving is we see a decrease in zinc, we see a decrease in selenium, we see a decrease in manganese, we see a decrease in copper. And yeah, if we leave these animals 2 to 3 months, they are going to start replacing it, but by that time we're in a breeding season and we're a little bit late. So basically what we did is we went to Texas A&M and said we want to do a study where we put the Multimin into a cow before calving. We will allow her to calve out, and then we're going to put another Multimin injection in 30 days before we start the breeding season. And what we wanted to see was to monitor how we change the mineral profile in those animals. So basically what you can see by putting the Multimin in here pre-calving, we actually delay that hit that they take. And the nice thing about that pre-calving injection is that you're actually treating 2 animals for the price of 1. You're actually going to supplement that calf in utero. That calf in utero is going to get some of this mineral. Now, once that cow calves out, there's no way we can stop that drop that she's going to take, because that package is just removed from her when she gives birth to that calf. However, you can already see a difference here is that the rate of drop in a cow that was supplemented pre-calving is much slower than it was in a cow that did not get anything pre-calving except oral exposure. And then if we can get to those cows in that window of 30 days prior to breeding, and we inject them there, we change this trend dramatically. You can see there's a much quicker response to elevate levels in the injected group than there is in the orally fed group only. And this difference that we create here is something which we research more and more to find out what the economic benefit of that is. Because if we can create an animal that has a better mineral status, how does that drive reproduction, and how does that change some of the reproductive parameters? So we actually took that same protocol and we went to Kansas State University and we asked them to please do a big herd study. So they included two separate locations, one at Hayes, one at Manhattan. They included 460 cows in the study. And basically what we wanted to see is if we do a pre-calving and a pre-breeding injection, what are the benefits that we're going to get? Now basically, the nuts and bolts, we improved calving percentage, and I'll show you some data on that. We improved fixed time AI pregnancy because they also contribute or continuously try and improve their genetic value of those calves. So they do use a bunch of AI to actually drive genetic improvement. We also compressed the calving season, so we had more calves born earlier in the calving season, and the cows treated with Multimin lost less body condition score between calving and breeding. So if we look at the preg rate data, this was the original Texas A&M study. You can see that we moved preg rates from animals that were in the control group to the Multimin group. It moved from 81% to 94%. In both of these studies, these cows were on a full oral mineral supplement for the full duration of the study, so we did not take any mineral away. You can see the cows at Manhattan and Hayes was managed really well. We had almost a 90% preg rate in the control group, but yet again, we added 3 calves per 100 cows in there. So there's a bunch of money in there that's going to pay for your product. So this is how you pay for the product, is we're going to give you 3 more calves in 100, and that's going to pay for spending the money on that product. Now, as I said, they make use of a fixed time AI program. We put the Multimin in there 30 days before they started their breeding season, but they run a short 5-day seeder program to synchronize these cows. Then they will do fixed time AI. They'll leave them for about a month, and then they will do a ultrasound scan, and then they will put clean bulls in, and then they will do another preg check 35 days after the end of the breeding season to differentiate between AI calves and bull-bred calves. And basically, if we look at the benefit that they got from the preg rates from the control group to AI to fixed time AI was 51.2%, and we pushed that up to 60.2%. So we had 9 calves out of 100 more born out of AI than bull-bred. So we all have 9 higher genetic calves more per 100 cows to sell in this program. If we look at the calving distribution, we also saw a benefit there. So you'll see that 65% of calves were born in that first 20-day window in the control group, and we moved that 65 up to 77%. So there's about 12 more calves that were born in that first 20-day window. So basically, if you look at it, we just cut the number in the second 20 days by half. We just moved it from 31 to 19, and we just bumped that on top of that. Now, very often people say, okay, so what's this worth? What does it mean to get more calves born in that first 20 days? And there's a very nice paper came out last year, which Rick Funston published out of University of Nebraska, where they looked at what is the benefit of having more calves born in that first 20-day window. So if we review the heifer progeny, if we look at the heifers born in that first 20-day cycle, basically what you're going to see is by the time they are old enough to be bred, you'll see that the heifers that were born in that first 20 days are going to have the highest preg rate. And it's a very simple thing to explain, because if they were born earlier, they're going to wean heavier, they're going to reach puberty earlier, and they're going to be more reproductively efficient. So if ever you have to get rid of some of your replacement heifers, Don't sell the ones that were born in that first 20-day window. Sell the other ones. These ones you need to keep. If we look at the amount of them then calving in the first 21 days, again, there's a big difference. We had 81% of them calve in the first 20 days, and their cohorts much, much less producing calves in that first 21-day window. Another important thing is if we look at the number of them that had to be assisted with calving, it is the lowest quantity. So you're actually going to have a group of heifers that are going to be easier calving than if you keep all these other ones. And then the biggest risk that we always have when we breed these animals is that when that heifer needs to be bred the second time, that's our biggest challenge. And again, you can see that they are the most efficient breeding after that first calf that they dropped. If we look at the steers that are born in that first 21-day, 20-day window, you can see that if we feed them out, those steers are going to be the ones with the heaviest carcass. They're also the ones that are going to have the best marbling score. And if we look at the carcass value between those different groups, the steer is going to be just over $60 worth more than one born in the last part of that breeding season. So there's a bunch of money to be made out of really trying to push and compress that calving season. Just an interesting thing, this is a more recent study where they actually looked at longevity of female animals. And basically what we looked at, the percent of heifers that remained in a herd over time with regards to which part of the breeding season they were born in. And you can see the blue line is the heifers that were born in that first breeding cycle. You will always have a bigger portion of them stay in your herd compared to the others. So it's actually another tool to reduce the pressure on you to drive and get more and more replacement heifers. So not only are you going to have a more reproductively efficient animal, you're also going to have an animal that's going to stay in the herd a little bit longer. So when do we use Multimin in a cow-calf operation? Basically, we will employ one injection at preg check. That was exactly how it was done in the Kansas State study when they did the preg check 180 days prior to calving. They gave the product there. The Texas A&M study was done 30 days prior to calving, so we have data to show that it's safe whether you give it far away from calving or close to calving. The data exists to give you that flexibility. The big thing that I like about doing this is if you're going to sell open cows, you don't have to treat them, you save that money. So you don't treat an open cow. If you follow this protocol, you will sell them without treating them. Then we will come in with a second injection, a minimum of 30 days prior to the onset of breeding in both cows and heifers. So we try and back it out 30 days or more prior to the onset of our breeding season. And then if we look at bulls, bulls are a little bit different because the semen that a bull will utilize when you put him with the cows was actually produced 65 days earlier. So we need to get into the bulls a little bit ahead of time, and we need to get into the bulls about 70 to 90 days prior to turning them out to the cows. I just want to make a couple of points discussing what happens to this calf from birth up to the point where we have a calf that we're going to wean and either sell or retain. And Jay Branham did a really nice study at Texas A&M where he serial biopsied these calves from birth right up to weaning. And I want to make 2 or 3 comments here. The first thing is if we look at these calves at birth, they have really high levels of trace mineral, and that is normal. People should not be scared when they get results back and these calves are really high at birth. They need to be high because they got to run off that for an extended period of time. Now the problem is that once they start growing and they start living and they start eating, they burn through about 75% of the trace mineral that they were born with within the first 2 months of age. So the first area where we're going to start seeing problems with the immune system is in this rapidly growing calf. If this calf was born with a level right there, it's going to be completely deficient by this time. So even before that day 56, we'll start seeing scours or respiratory disease. Now, unfortunately, this trend remains approaching weaning. It stabilizes out a little bit, but it's not increasing. So very often around weaning is when we start employing a bunch of vaccines, and very often we have a lot of these pre-vac or preconditioning programs that do not really work well. And one of the reasons why animals do not respond that well to these pre-vac programs is because we have an immuno-incompetent animal. We have a bunch of really good trace vaccine that we're going to put into this animal, but it's going to be mineral deficient. So it will not respond that well to the vaccine. So typically, when we look at opportunities to do something to the calf, the product is labeled to be used at day old. So we can actually, if we have a bunch of cows that we bought them out of a drought area and we know that they were scruffy and people didn't pay attention to them or didn't look after them, yes, we can fix up that calf at day old. We can contribute to trace mineral status and give it to it immediately after birth. However, if that is not required, if the cows were taken care of really well, we have an opportunity at branding. If we're going to handle those calves at branding, this is really when we have a low spot and we need to see if we can't contribute to these calves. And then obviously, when we approach weaning and we're going to employ some vaccination protocols, it would be good to pay attention to the mineral status of those calves right about weaning. And that is the whole deal on the breeding cycle and the use of multimin in breeding cattle to ultimately produce a really good steak.